Welcome to the Mommy Mentor Podcast. This parenting bullshit is hard, am I right? From sleepless nights with newborns to sleepless nights with teens, from potty training to sending them off to college, I'm here to get you through it all as your mommy mentor. My name is Erinn Kennedy-Heldt, and I'm a registered nurse and a mom of 3. I have professional experience with moms and babies as a postpartum nurse, which keeps the postpartum and newborn experience fresh in my mind. And I have 17 years of parenting experience as well. For information on this podcast and more, go to mommymentorpodcast.com. Parents, grab a cup of whatever you prefer and settle in for the next episode. Hello, everyone. I have a special guest this episode. She is very smart. She is a hospice and palliative certified family nurse practitioner. And if you don't know what that is, don't worry, I'm going to ask her. I was inspired already to do an episode on pregnancy loss, and she then messaged me and I said, let's do this episode together. It is Meredith Goodwin. I just wanted to ask you, what is your role as a palliative family nurse practitioner? What do you do?
So as a hospice and palliative nurse practitioner, I was on a hospice team. I would go into patient homes and help manage symptoms that come with the dying process. So with hospice and palliative, this is when a patient has to qualify for hospice. 2 doctors have to agree that they would not be surprised if the patient would pass away within 6 months. And then if it's okay with the family, they can do hospice, in which we would do no aggressive interventions, right? So they could still go to the hospital if they want to, but then they'd come off of hospice care. If they decide to stay with us, then we just manage symptoms. We don't do anything aggressively life-saving. And my role as a provider was primarily to manage pain, to manage breathing symptoms, to help the family recognize when a patient was moving into the next stage of this process, and to help prepare them and talk them through grief and connect them with resources and all of that. So gotcha. I did that both virtually and in patients' homes.
I see. I was a postpartum nurse. I still do that part-time, and I am now a care coordinator, so at a hospital, and it's an oncology unit. So I send people home with home care, but my coworker, the social worker, she does a lot of hospice placement. So I have dabbled in a little bit of hospice placement, so I kind of know a lot about the rules that you just talked about, which it seems crazy to have to talk about rules with hospice and end-of-life care, but that is our system.
Yep, that's how it goes, unfortunately.
Yes. But primarily, I would like to focus on what kinds of things would you do for the family, like emotionally support, and what resources would you give them?
So the resources side of things, I always like to go very factual, very what to expect, anticipatory guidance. Having been a family member of somebody on hospice myself, especially as a child. I lost my father when I was 14 to cancer. And when nobody is telling you what to expect and nobody is walking you through what is going to come next, it gets very anxiety provoking. It's very scary, and not everybody wants to know, right? But the first thing that I always ask family is like, do you want to talk about what's coming next? Let's talk about what we see right here and what this means. And do you want to know what comes next and how we prepare for that? Gone From My Sight is a hospice book that's written by a hospice nurse who has 50 years. Any nurse anywhere knows about Gone From My Sight. It's in school. It's we talk about it all the time, but it's very simple. It's very basic reading level. It's easy to understand, and it does a very good job generalizing the 4 stages of the dying process. Recommend that to everybody. The other things resources that I would give to families, a lot of times like the LNEC website is good at individualizing symptoms and symptom management. In my organization, we have symptom management cards, which say individually pain, shortness of breath, anxiety, constipation, all the things that we really focus on in hospice, and what tools you have as a family or caregiver to manage those things. It's really helpful to a family. As far as the grieving process goes for families, really depends on what stage of life the patient or their family are in, right? If you have a grandmother who's the primary caregiver of grandkids, that's a whole different deal than somebody with adult children who they were expecting this. Grandma's had dementia for, 5 years. And so that gets really individualized by
Yes.
family. We do a lot of connecting people to grief support groups. We do a lot of connecting people to volunteer caregivers just to offload caregiver burden and caregiver stress. We have a bereavement coordinator who has a PhD in divinity. She's like the coolest person I know. And she does a really good job with the kids. She'll bring books and she'll sit down and she'll talk to them. And also understanding where a family is coming from. We have some families who are really avoidant and they don't want to talk about death and they don't have any processing, no coping mechanisms. And so addressing that with those families is a lot harder than families who have like an established, this is how I think about this is how I feel about this is how I talk to my kids about this. If they don't have those structures in place, it can feel very catastrophic. This is only happening to me. This is only something that's affecting my family. And that's a lot harder because I can't force you to pick a way to think about death, right?
Yeah,
so,
for sure.
Yeah,
for sure. You spoke about so many things that are familiar to me. I'm glad for all the information. Yes, it's all good. And I am sorry about your loss of your father at 14. I was a little older, 23, but very sudden death. Yep. And also I had just had my twins who were born prematurely. Gosh. So it was ridiculous timing and probably not so good for me emotionally.
Probably not.
Yeah, grief is definitely tricky, and you have to like factor in, like you said, what stage of life are these people in? Do they have young children? Are they primary caregivers? Are they not primary caregivers? Right. What resources do they have and their families have? And what is, like we also have cultural things to consider. And that's beside just how are you doing emotionally and how are you grieving and do you want to talk about this?
Right.
Yeah.
Right.
Yeah, but I think for myself, I would prefer knowledge. So I think it's great to give those options because I think knowledge is just like huge and you can kind of recognize it and then walk yourself through the grieving process step by step, really, just because you can recognize what's happening in front of you.
Yeah. Yeah, I agree. I feel most families really prefer to have at least some sort of, even if they don't want to talk about it right now, they're like, I want to leave it, but let me leave this resource so I can see what's coming when I'm ready.
Yes. Yep. A lot. Sometimes you're just leaving it and letting them come to it when they're ready.
Yeah.
Yes, definitely. Do you have any experience work-wise in helping patients and families through pregnancy loss and grieving?
Only my own.
Only your own. Okay.
Yeah, I've
Same
not
here.
worked in that arena. Yeah.
Same here. Because I'm a postpartum nurse and to be honest, when a person needed to have like a DNC or something at my hospital, they never came to the postpartum unit because there's babies there. You do not
to stay away from that.
You don't put people who had miscarriages on the postpartum floor. So I never had experience in caring for people in miscarriage either. However, I've had my own. And I know a lot of people who have had them. They're very common. Unfortunately, 1 in 5 people, and they can just happen for a lot of different reasons. Yeah. And just personally for me, it was sudden. It was weird. I had the girls. They were twins, but they were preemies. So because of the twins, not any other reason. And then we wanted to have another child and I got pregnant and it was fine. And then boom, miscarriage, and it was about 8 weeks. And then we tried again a year later and I was 20 weeks and the baby actually passed like 2 weeks before that. So it was 18 weeks when it died. And then I had a DNC with that one. And after that, my OB was like, okay, like what's going on? And did a whole bunch of labs and things. Turns out I have factor V Leiden. I need to be on blood thinners when I'm pregnant. Yeah. So who knew? I didn't know. And also I was on estrogen-based birth control for 7 years.
Our stories are very similar. Yeah.
That's so scary.
So scary.
Yeah, a lot of women find this out this way, unfortunately. They find out things about their health this way. And so then my third one was because we started the Lovenox too early. And then I got my son and now he's wonderful and 12 and I swear wasn't going to come out even at 39 weeks. So yeah, he took his sweet time. And so it all worked out. And I'm glad to know that I have the clotting disorder because I've also passed it on to my daughters. But to find out that way is not fun. No. Definitely. Like I said, I've shared my experience with miscarriages, and I know you can share as much as you want or as little as you want. But as both of us who are healthcare professionals and we have experienced pregnancy loss ourselves, how did you find your job helping you cope? The fact with the job that you do, how did that help you cope?
First of all, I want to say, as a healthcare system, I think that we have come a long way in caring for women who are undergoing pregnancy loss, but I also feel like we have a really long way to go.
Oh, yes.
I feel like, back in the day, it was like, this is happening, and then it's hush hush, and everybody treats you like it's hush hush, and nobody wants to talk about it.
Mm-hmm.
And that is very isolating and very scary and
Yes.
feels, stigmatizing. And there, we've come a long way in researching the causes of miscarriages and pregnancy loss. But I also think that the way we train nurses and doctors to talk to women who are going through this loss, it leaves a lot to be desired still.
I agree.
The only help that I got from undergoing this process is from the bereavement coordinator at my work. It was, not from, and they have resources at these centers, but the most that they do is like, oh, here's a social worker if you want to, and
Mm-hmm.
and maybe it's just my experience, but I had some
I would agree.
negative experiences with the kind of like post grief support groups when I lost my dad, and so. And obviously, I was a teenager and I was very young.
Mm-hmm.
That was a long time ago, and so
Mm-hmm.
it's different. But I just very much did not want
Yes.
to talk to a group of women who had been undergoing the same thing.
Mm-hmm.
And I didn't want to sit with anybody who was going to be cheery and like talk to me like I was a child. That really bothers me.
Mm-hmm.
I'm sure it bothers everybody, but that
Oh,
was like
yeah.
the vibe that I was coming
Yes.
up with. And I think that treating women who are undergoing a loss like this as if they're having a loss is really important.
Mm-hmm.
Acknowledging that there's grief that comes with this. When you address a woman who's having a miscarriage and say, oh, well, this happens to a lot of women. Like, I'm sorry. People experience loss every day. That doesn't make it less impactful of what painful of what I'm going through. And so I would say that the number one thing that my job helped me with is having a very established foundation of like how I think about death and dying and what I think about life and what does that mean, especially coming, and I might get myself in trouble here, but coming from a very religious background that shames a lot of pregnancy loss.
Yeah.
And being able to say like, oh, hey, like this is not something that I did, and coming to terms with my beliefs and feelings about what is a life and what isn't, and how does this make me feel about needing to have a DNC, needing to take an abortion pill because I did twice have to clear out fetal tissue. And that was all a framework that I had established because of dealing with grief in my job, not something that the people who were responsible for caring for me were in any way equipped to walk me through in any of those times. So it was more my job
that helped you cope with this than the care team. And I mean, I would likely agree. I didn't have horrible experiences, but at the same time, I don't know how old you were, but I think my age had a lot to do with it. I was in my early 20s and I was just, I don't know, something about that age group is just like, no, I got this. Because you're just trying to be an adult, I think, and you're just like overly aggressive about how you can handle things. Maybe that's it. I don't know. But for me, I was just like, no, thank you. I have it under control. And do you want to have do you want to have a burial? Do you want to have the information? No, thank you. And I was just like denial. And that is absolutely not the way to go about it, because like, however many years later, that's going to come and bite you in the butt. But the people who were providing the care weren't finding out like, what is her why is she like this, they just let me keep my door shut, let me just leave it alone, leave me alone, kind of a thing. And my doctor made a mistake. Like, I didn't want who wants to know what a baby that I mean, I don't know, maybe people do if they're older babies. Mine were young, like not viable at all, And so I thought that there were people, but I didn't want to know what this baby was, especially the oldest one that I had miscarried. And they sent everything to the lab to, because as they do, to check and make sure everything's fine genetically. And my OB, who I love, by the way, and she's still my OB to this day, she's been my OB for 17 years, but she is just like not, and I get it because in healthcare, this is our job, like sometimes
Right.
we can get so like lackadaisical about it and just like it's something that we do every day, we see every day, we like are exposed, and so it's almost desensitizing in a way,
Mhm.
which is unfortunate because that is not the way it should be. And I try really hard when I'm caring for women, not like I said, not with loss, but obviously postpartum women are emotional, um, to try to like put myself in their shoes as much as humanly possible. But my OB made the mistake of telling me in a voicemail that I had miscarried a healthy baby boy. And I'm
Oh,
like,
good.
well,
Yeah.
great. That's
Yeah.
wonderful that he was healthy. Unfortunately,
Until
he
he
didn't
died.
until he died. Thank you.
Right.
Right. So, and I mean, I'm just like, ugh, that was
Yeah.
like a gut punch a person doesn't need. So it's like, I would agree with you. The healthcare system, and it is getting better.
Yeah.
But the healthcare system does not address pregnancy loss as it should at all.
No. No.
No.
Yeah.
And the emotional aspect. And also, like, we're not even talking about the dads or the partners.
And there's nothing for
There's
them at
nothing
all.
for
There's
them at all.
nothing. That was, I mean, my husband's a surgeon. He's in the healthcare field just like I am. And I mean, there wasn't even any offer to
No.
for him to talk about it. So then I felt, and this was not his fault. I say this very, very clearly. He did not make me responsible for his grieving process, but I felt like I had to manage not just, I mean, because so we didn't get into my story and we can talk about it. But I had 5 miscarriages in a row.
Oh, wow.
And the last one was the one that we finally thought, like, this is it. It made it past 12 weeks. Things are
Yeah.
doing fine. And just like you said, like with
Mhm.
yours, mine
Mhm.
wasn't quite as far along, but it was 15 weeks and he'd been dead for 2 weeks. And
Mm.
um, so I already knew we had done genetic testing because we'd had so many before this. We were like really worried about it. No one would give me anything to try to, they didn't want me to do progesterone. They didn't want me to do Lovenox. They didn't want me to do anything because we didn't have any evidence for any of this.
Mhm.
Which I
Yeah, and you're
understand,
like,
but I'm like,
you're
but
like,
I
there's
can't keep
5.
rolling the dice on this. Yeah, like
Why
the
aren't we
stats are
intervening?
bad.
Let's figure this
Correct.
out. Yes,
Yes.
yes.
So, and on this 5th one, and it just people knew like I had one at 8 weeks, one at 6 weeks, and 3 that were so I've actually had 6 miscarriages, but
Oh,
5 were after my live birth daughter, and the one before, like it was at 5 weeks, it was like didn't really
right.
register to me,
Yeah. Yep. Yep.
Um, and I had my daughter, and then I had one at 6 weeks that was healthy, one at 8 weeks that was healthy, one at 6 weeks that had a trisomy. After we did IUI, they did all that one was non-viable, and we found out really early.
Okay.
And then 2 more chemical pregnancies that were like, 5 weeks tops,
Mhm.
just positive pregnancy test, and then no more. And then the 15-week one. And that one, we got past 12 weeks. So we had told everybody, we had told the
Ah.
parents, and we had told the people at work. And because we were in the process of moving from Michigan to Illinois, and my husband was finishing fellowship, and there were just so many people that were aware of what I was going through, and so many people try to be so helpful. But a lot of times you end up feeling like you have to manage their grief as well.
Oh, yes. It's okay. I'm okay.
Yes, like you don't need to worry about me. Let's talk about you, which is
Yeah.
just not
Oh,
the
I'm so
space.
sorry. And then you're immediately taking it on like, oh no, everything's fine.
Or they jump into their story about loss, which is again wonderful. Sharing is great. We want to be open, but when somebody is in the immediate throes of loss, talking about
Mm-hmm.
your loss is just
Mm-hmm.
really, really not helpful. Like
No.
even if you've had a good outcome after, even if you've been through, because again, it's like if you lost a family member. No, I didn't know this baby for very long. No, I didn't. But I hearing about the death of your dad does not help me process the death of mine when
No.
I am struggling,
Mm-hmm.
right? So
Mm-hmm.
um there was a lot of that. And then circling back to my husband again, there's no resources for him. He's obviously struggling. He was very excited about this baby. It was a baby
Mm-hmm.
boy. He was very happy. He was very excited about that. And then we're both up all night crying. We're both, trying to go to work and trying to pull the pieces together and trying to parent our 3-year-old at the time and explain to her what was going on and, why mommy and daddy are sad and why grandma's here and why is grandma sad. And, that was another thing. She had known that I was pregnant. And so we had to sit her down and tell her and then process her grief through that whole thing, which obviously is very tricky. She's 3. There's a lot of grieving processes that happen when you're 3 that don't happen when you're an adult, right? And so when you just leave women who've had a loss with no resources for their partners, no ways to tell their kids again. I was very fortunate. I work with grief. I work with death. I have resources to talk to my kid about this. I recognize stress responses for what they are. But even so, it was a very stressful time in my marriage. And we had jumped right into doing IVF after and, walking through that. And I remember very vividly my husband being like, I'm doing this with you. And I was like, then why do I feel like I'm doing it alone? And it was a horrible thing to say, say things like that to your husband.
No.
But it was it was very, very rough knowing that I am the support system here. I am trying to hold all these things together. But yet this happened to me, right? Like, yes, it happened to everybody else, but it happened inside my body and it happened. I am the one with the hormones and the weight and the, everything.
Yep. And I'm the one who's wanted children since God knows how long, and it's in my body. Like, you don't understand, the connection is different. Right. Yes. Yep. I understand. My husband, like I said, I coped by denial. So I denied all of his feelings too. We, like, everyday life just went on. We had twins, to be fair, so they keep life busy.
You have to, yeah.
But they were only 18 months in my first miscarriage. They didn't even know I was pregnant, and there was no explaining that to a 1-year-old exactly, even if they knew, but they didn't know, and they never knew. When I had a miscarriage with the last one, I don't know. I am unsure how they didn't know I was pregnant, because I was like 18 weeks, right?
Right. You look pregnant at that point.
I looked pregnant at that point, but it was winter, so I was lucky enough to wear like large sweatshirts and stuff. And, maybe mommy just was getting fat, who knows, but they didn't notice anything. And that was my biggest fear with my son, my rainbow baby, was that they are 4 now. They're 4.5. They're going to be 5 when he's born. I can't even fathom explaining this to them. And that was like a huge fear for me. And honestly, it was a top fear. It was above my own grief, to be honest.
Yeah. Because it's worse to explain, to watch your child grieve something than it is to feel it yourself.
Yes.
Yeah. And it's important, regardless of the grief that you're talking about, you want to explain things to children in concrete details. You don't want to use euphemisms. You don't want to lie, because even if you're trying to protect their feelings, children are very smart. They know bad things happen. And unfortunately, especially if you're in the under 4 age group, they tend to think if something bad happens, if it hasn't been explained to them, they tend to think it's their fault for some reason. It's just a thing so we wanted to be very, very factual with my daughter, very concrete. And what we said was that, I know, because she had to be picked up from daycare by a friend. We were in the hospital all night. It was just, rough for everybody.
Yeah, life was different, and we had to explain why. Yes.
Right. So I sat her down in the morning. I said, I know that mommy was in the hospital last night, and that's because I went to the doctor to check on the baby, and there was no heartbeat. And so his heart stopped working, and he had stopped growing, and he died, and the doctors had to take him out. And that's something that, it's still a lot to process for a 3-year-old.
So much. Yes.
Right. And the first thing she did was the first thing she did was like hit me and cry, because she was 3 and she's angry and she doesn't know why she feels that way.
Of course.
And so we had to talk about, like, I know that makes you sad. Mommy's sad too. Mommy's angry too. Well, you can be angry at mommy. That's okay. And, then realizing that once she processes through all these emotions, it's going to come up later.
Oh,
right? Yeah. So you hear about it when we're crying and everybody's upset, and she goes into like a little bit of regression. There's more tantrums, and she's not telling you why. She won't tell you why. You just have to give her a little bit more grace than you would if she were just acting out because she's at 3, right? Like, there was a time, I brought this up in another conversation like this, but my mom was there helping us out, and she had some popcorn, and Reagan was my daughter. Reagan wanted some, and she would just try to take it from my mom. And my mom said that we don't like that. We don't do that with grandma. And then Reagan got really upset, and she was like, I want popcorn. It was like 2 days after, right? We'd been in the hospital, and my mom went into the whole thing like, we don't talk to grandma like that. That makes grandma really sad. And I like ran
You're like, hold on a minute.
Like, this is not what's happening. Like I picked her up, and she's just like bawling. I was like, this isn't about the popcorn, right? Like, this isn't about, and she's sad, and we have to talk about this. I understand that you're sad. I know that you really wanted to be a big sister. You really wanted a baby brother, and mommy's sad too. And, you know, we can get some popcorn. It's okay.
Yeah, definitely. We'll get you some popcorn.
Right. We'll get you some popcorn. It's fine. And so, you know, obviously that conversation changes as you get older, but, you know, even so, further down, my daughter's 4, and just turned 4 in November, and I'm pregnant again. I'm 26 weeks. Thank you. I know we're doing pretty good. I'm on Lovenox as well. I don't have factor 5, so they just did
I'm
it
just so excited. My girls were born.
Yeah,
my girls were born at 28 weeks, and I'm like, girl, you're fine. You're
I'm
fine
good.
now.
He's viable.
You're
he's okay.
Fine.
Yeah, and he's been kicking me this whole time.
He's like, Mom.
Yeah. He's like, Mom, you're talking about me.
Oh,
but
amazing.
Yeah. So there was a time I got pretty sick a couple weeks ago, right? It's just like, oh, my body hurts, and I just had to lay down for like 3 days in a row. And my daughter was getting all anxious and weird, and I was like, what's wrong, honey? Like, what's going on? She was like, but is the baby sick too? Like, is his heart stopped beating? It's like, no, honey,
baby.
no, he's okay. He's fine. We just, you know, we went to the doctor, and he's okay. And so addressing that those fears come up later.
Yes,
you know,
definitely.
and reassuring that's not just you that's anxious about baby. It's, you know, it's,
oh
it's
my
important.
gosh, everyone's anxious.
Everyone's anxious. Yeah.
Yes, definitely. Yes. Yeah. Wow. Oof. Yeah. That was one of my questions, is you answered it already, was like, how are you parenting her through grief? And are there books and resources or websites for children, like helping your children process grief?
There are so many.
Okay.
And that's so part of the reason that I get into podcasting is I write children's stories. It's on my podcast.
Yes,
It's what I do.
forgot
I read
to tell the people
stories.
that.
It's okay.
He writes and illustrates children's stories.
And I read them on my podcast, and
great.
I have some that are, you know, I hope to have a YouTube channel with the fully illustrated versions. Not all of them are like, let's talk about a hard subject, but some of them address. I got a chance to guest star on a bedtime stories for children's podcast, and they read my story Happy Pizza, which is about, I talk about my loss in that story, and, you know, from a child's perspective. And so there's, and I've had multiple women who I know who've also been through loss with children, and they're like, I love that story. We talk about Happy Pizza all the time. And so that one's not on my website yet, but I'll give you a link. I'll email it to you.
Perfect. I will put it in the show notes. It'll be in the show notes.
So as far if we're talking about literature, which is just, I think, so important, if we help kids, if you can find yourself in literature, you can find a way to walk through whatever problem that you have, right? I think that's a huge coping mechanism of mine. So if you just like Google kids books, grief, there are age appropriate books from 0 to 18 that walk you through grief. And I went through and tried to make a list, and there's just so many. So just Google it.
Totally. Yeah.
But I also have a list of resources specifically for kids who are experiencing grief. There's several different websites. One of them is like, you can order a care package for the kids that are going through grief. One of them has talking points. One of them has support groups in your area. One has, networks. So I'll send you all of those. You can include them.
Yes, I will put them in the show notes. I sure will.
Yes. And then the other thing I'll say is that we have, I guess your kids are older, but people who have kids my age have been blessed to be parenting in the age of Bluey. And Bluey is so amazing when it comes to
I actually hear about Bluey.
Yes, about grief.
Bluey is very progressive.
So progressive for parents, progressive for kids, progressive for grief. Bluey is amazing. So
yes, I've heard this. Like, I think, isn't there a miscarriage episode?
Yes, there is.
I heard about that. Yes.
Yeah.
I'm like, genius. This is amazing.
That's great. It's just such a great resource for parents. So finding books, and I think also You talked about how you were so avoidant in your coping when you were 23. I don't think that's age dependent, but it is also very, because I'm avoidant and I
It
was
could easily
30.
just be the way I cope with things.
Right. I'm 36. I coped the same way when I was 14 as I do when I'm 36. So like it was, yeah. But it is a very teenage way to cope with grief, is to shut down and be like, I don't want to talk to anybody about anything. You just leave me alone until I get through this.
Mm-hmm.
And so a lot of times if you have somebody who's that's their coping mechanism, if you hand them a book about the thing that they should be coping, they're like, no, thank you. I don't want that.
Absolutely.
And so when you find something that touches on this, but it's not about this, it's so helpful to have, this character is going through things, but that's not the point of the story, because it's not the point of our lives either, right? No one is wanting to sit through life and think, gosh, my life is about getting through grief, because it's not. Life is great. There's a lot of other things good to be happening in life, and it's not my main journey to get through grief. And identifying that coping mechanism in stories when it's not all about this one thing is so helpful, right? Because life goes on. So for children, like Harry Potter is really great with that, because Harry goes so many
love
things.
Harry Potter.
I mean, doesn't everybody in our generation really?
Yes.
Classic millennial. I love Harry Potter. But he copes with the grief of his parents, and he copes with the grief of his parents through his age groups, which is something that happens to kids who have lost parents. They process again and again and again the loss that they've been through, and he processes the loss of friendships, and he processes this big bad world that he's living in, but it's not necessarily the point of his journey. And I think that's why so many people resonate with that story. It can give them coping mechanisms without beating you over the head with them.
Yes. Yeah, definitely. You're like entertained by the story, but you can see yourself in the main character. You can relate to the story, and I see that's good for teenagers and / people who are in denial.
Right. In general.
In general. How would you suggest partners support the person who's they are experiencing the loss, but the person who is miscarrying or has miscarried?
I mean, first and foremost, I would say that it's kind of twofold. Recognize that no matter what stage you have this miscarriage in, your body's going through a lot. So, I mean, we're hoping everybody has supportive partners who are feminist and lovely, but that doesn't happen all the time. No. You can't expect that your partner is going to jump up and keep the house clean and do the same childcare that she was doing before, because her body is in pain. She's either gone through a massive abdominal procedure, or she's taken medications that have made her have the worst period of her whole life. She's processed potentially seeing fetal tissue in the toilet, which is the worst thing that has ever happened to me personally. All of those things are very traumatic. They hurt. Your body will not feel the same for a while. Expecting a body to function the same is not fair or right. So that's like a very basic need.
Very basic. Yeah. Like I'm not okay. Treat me as if I had surgery, because I did probably.
Right. I'm not a powerhouse. I can't do this without some downtime. And the other thing I would say is process your own grief the best you can, right? Recognize that your partner will want to talk to you. She will want to, if she can, talk to you through these things, but your grief and the things that you are going through are your responsibility. They're not hers. And however you need to deal with that, do it. Go, use your coping mechanisms, go to therapy.
Please, men, go to therapy.
Right, please,
men.
All men should go to therapy.
Like anyone, everyone, but men for real.
But men for real, go to therapy. And so the other podcast that I've been on that I talked about this with is a man named Hanania Abraham, and he's a therapist. And it was just so, because it was a very different conversation, but we talked a lot about how therapy can help with all of this and how we use literature and therapy and all that stuff. But my point is, therapy is great for everybody, and not just for the person who's had the loss. It's good for partners too, because again, your partner is not your therapist.
Right.
Which
definitely
is an important distinction. Those would be my big three. All
right.
Use your coping mechanisms, go to therapy, and treat your partner as if they have undergone massive bodily injury.
Which they have.
They have.
Yes, and not only that, it's also a massive emotional, mental injury too. It's not just like, oh, I had surgery. So I really appreciate your time. It has been so good talking to you. It's been on my heart to do an episode on miscarriage. I have a coworker who is, us postpartum nurses are very open about this, but which is wonderful, as it should be.
Yes.
But she recently experienced another miscarriage, and I just was, so I wanted to do an episode because it's been on my heart myself, and October was Pregnancy Loss Awareness Month. So, and then your message showed up in my inbox, so your timing couldn't have been better.
Perfect timing. It's meant to be.
Meant to be. What is your website again?
My website is Open Window Stories. It's on Buzzsprout. I'll send you links. And I'll send you all the resources that we talked about. But thank you so much for having me. This has been great.
Yes. Everyone, this is Meredith Goodwin, once again, a family palliative nurse practitioner who has, like me, experienced her own loss, and our losses definitely acknowledged.
Yeah. Thank you again.
Thank you. I really appreciate your time. That was Meredith Goodwin, family palliative nurse practitioner. Thank you, Meredith, so much for being on, and thank you for being so open and sharing your stories. It is my hope with the Mommy Mentor to make moms and parents feel like they're not alone in this parenting game. It can be very isolating, and especially when the only people you talk to in a day are children. So I hope that if you saw yourselves in one of our stories, that you found comfort in it. If you'd like more information, resources that Meredith provided about grief and how to cope with it and how to cope with loss, there are links in the show notes. You'll also find information on her book. And if you would like more information on this podcast, you can find me on Instagram at my mommy mentor, and my website is mommymentorpodcast.com. I look forward to hearing your thoughts on this episode. Please message me if you have any thoughts or questions or feelings about this episode. I would love for you to DM me on Instagram. And also, if you have any ideas or topics you'd like me to cover in future episodes, please, I am open to suggestions. You can message me on Instagram, my mommy mentor. Have a lovely whatever time of day you're listening to this episode, and I will talk to you guys next time.